Hey guys, Dr. Putney from Wellington Family Chiropractic, and today I want to talk about a hidden cause of upper trap or pain right here in your shoulder, down inside that area between your spine and your shoulder blade. So this is a very common area where people struggle with pain quite frequently for a lot of patients, and there's a lot of different things that can cause it. Now, sometimes it's just joint stiffness, poor posture, tight muscles, an imbalance in the shoulder muscles to where you need exercises in order to correct that long term. Sometimes the hands-on treatment that we do here at the office with manual therapy, stretches, adjustments really helps. But for some people, they've been given stretches and exercises, and it doesn't seem to get any better. In fact, if they're exercising, sometimes the more they move, the worse it gets, which is not just a muscle problem typically. And so what this condition is called is a dorsal scapular nerve or neuropathy. And essentially it means the nerve itself, the dorsal scapular nerve, is getting compressed and irritated. Now, where does the dorsal scapular nerve sit? Well, it comes out of this region, travels down to the tip of the shoulder blade right in here, and then it kind of covers that whole area from the tip of your shoulder blade there. And just think about that whole area between your shoulder blade and your spine, kind of across over the top of the shoulder. If you're having pain in that area, that's the area the dorsal scapular nerve innervates. And so if that area gets compressed for one reason or another, a lot of times you can have burning, you can have tingling, or just pain in that area. And like I said, a lot of times it doesn't get better with stretches alone. And it can actually get worse the more active you are, the more you're moving your shoulder around. So sometimes these patients have frequent pain. They can have weakness trying to elevate their arm overhead or reach overhead. A lot of times these patients develop weakness in portions of the mid and lower trap to where they cannot retract or bring their shoulder blade back and down. They struggle with weakness there. And so there's a couple things you can try. I'll give you the stretches to try. It does very well with what we do in the office in terms of, again, some of the adjustments and exercises we prescribe. So it's nothing to be worried about. Sometimes people worry about like a nerve condition, but this typically can clear up if you're doing the right things. But if that sounds like what's going on with you, and stretches alone aren't helping it, and the more you're active, the worse it gets, I want to give you one thing to try. So if we just talk about stretches, so I'm going to give you multiple things to try, but a lot of times people say, well, I'm doing, like a cross body stretch, trying to pull that muscle. I'm stretching my trap, which the way you do that is to pull on the top of your head straight across and maybe tilt down and over, and it stretches the trap. I've tried that. I've tried getting in a corner, opening my chest up. So on each side, if you go into a corner, arms here, leaning into the corner, stretching my chest, nothing's helping. We'll try this exercise or this nerve floss here. So this is for the dorsal scapular nerve specifically. And the way you're going to do this is you're going to have your arm straight out to the side of you. And then what you're going to do is bring your arm straight across, keeping it straight as you turn your head back towards the affected shoulder. From here, we're going to straighten the arm, and we're going to turn the head the opposite way. So it's just this continual movement back and forth, keeping the arm straight at a decent pace here. You don't have to rush through it. Back and forth. And so the idea of the dorsal scapular nerve glide or floss is basically to take that nerve that glides through the tissue and just try to mobilize it as it's weaving through your trap and down inside your shoulder blade. Sometimes it can just get stuck on a muscle or some sort of soft tissue, and that creates that irritation to the nerve or minor compression and makes your symptoms worse. So it's a very easy movement. We're just here and here, but what that can do, combined with the right stretches, is free the path of that nerve up, take any irritation off of it, and it can dramatically reduce your symptoms. And long term, you can regain your muscle strength there and get over this type of pain. So the three stretches, again, that I prescribe are going to be the cross body stretch, where you're just grabbing here, pulling that shoulder straight across. The upper trap stretch, which is either straight to the side or slightly bent, going forward. And with both of those stretches, you would hold those for 10 seconds up to 30 seconds, and you can do a few rounds of those twice a day. And the corner stretch. So the corner stretch, you're in the corner, you're leaning your forearms against the wall, leaning forward to stretch your pecs. And the combination of those three stretches really helps to decrease muscle tension in the area. But for some people, they need that nerve glide, which again is here and here. Very easy movement to do. And typically I'll have patients do 3 sets of 15 of those, maybe twice a day, just to keep that nerve moving and try to get it to glide through the tissue. So if you have pain on the top of the trap or down between your shoulder blade and your spine that seems to fit this category where it's just not getting better on its own, it gets worse with use and can really ramp up the more active you are. It could be that dorsal scapular nerve causing the problem because it's compressed or irritated. So give those stretches and that nerve glide being very, very important. Give those a shot and see if over time that area calms down, because on a lot of patients it does. So if this is you, give it a shot. I hope it helps you guys out, and I'll talk to you soon.